Like when I was younger, I thought, okay, this is just something happening and it's gonna grow back, so I don't have to worry about it, so I didn't.
It looked like my hair was just thinning a little bit, but I really didn't notice it because I wore a lot of different hairstyles.
I can distinctly remember asking, and my stylist told me that no, it wasn't a problem.
My hairstylist one day made mention that this may be alopecia. And of course I went and Googled it, tried to find out what this was about, to see if it was something that was hereditary, or to see if it was something I brought on myself with all those fancy hairdos I had in the 90s.
CCCA is an abbreviation for a very common form of hair loss that we see primarily in African American women. It stands for Centrifugal, Cicatricial Alopecia. That's a mouthful, so that's why we call it CCCA for short. Usually, the hair loss starts as a very small round circle and it progresses outward until it can encompass almost the entire scalp.
Really, the very first thing to get a diagnosis is to come to see a dermatologist. Dermatologists will look at the pattern of hair loss because not all hair loss is CCCA.
Your scalp is not supposed to be itchy, it's not supposed to be painful or tender, and you're not supposed to lose hair on the top of your scalp either.
Hair loss in women is very traumatic. I mean, it's traumatic in men, but hair loss of all causes in women is traumatic.
I'm always wondering, who's looking at my hair? Did somebody notice?
It has affected my personal life in lots of ways. My self-esteem, well, let's just say I'm very conscious of it. I wear lots of wigs. I felt really bad about it, and I started slowly going into a depression over it, but I kept it covered so I wouldn't have to see it.
What's really sad about this condition is that patients still don't know about it. Many stylists and beauticians who take care of patients who have it don't really understand it, and so oftentimes they go untreated for very long periods of time, dealing with the pain, trying to cover this very severe hair loss the best they can with wigs and hair pieces and elaborate hairstyles. And all of this happens before they get to the dermatologist.
I wore my hair up a lot, pulled up, and there was some styles back out in the 90s where we had this really big ball at the top.
I was wearing a lot of braids and weave.
And my stylist would do different designs, and at the time I had a female, so she would bobby pin them in the very top of my scalp. And to be honest, it hurt.
Because I'm saying to my stylist, pull it tight, when I'm getting it braided. So I'm like, pull it tight so that it'll last longer, not knowing that I'm putting more tension on my hair as she's braiding it really, really tight. And so I was doing more damage than I was good.
There is some exciting research going. Their treatment research is to compare different treatments in terms of what works. There are genetic studies, which will be very exciting, that can help predict, who might get this, and that is something we could really work with children. I think the prevention,
whether it's regarding treatment or evaluation techniques or what's going on under the microscope when we take biopsies, we're really starting to get a nice roll of people interested in this disorder.
So many come and they have, it's late. I mean, it's really large areas, greater than 6 inches of hair loss they've covered, and then the areas get so big that they can't cover it, and that's when they come to see us.
We tend to do better with treating the symptoms of itch, pain, stinging, tenderness. All of those can be treated very nicely. The harder part in treatment is really treating the loss. We're not expecting to get all the hair to regrow in this disorder. What we're expecting is to stop progression.
I really wish somebody had said, hey, you need to go see a dermatologist about this, just for your own good. That's hindsight. I really wish somebody had told me that.
Take the advice of the dermatologist. If the dermatologist is telling you, hey, this is what you need to do to your hair because you're damaging it, take that advice and follow through with it.
We need to see you before it gets severe, before we can't do anything. So if nothing else, the goal of this video is to get you in and let us take a look at your scalp and stop this very severe scarring process before it really takes over.